Tonight, we are organizing for healthcare justice in all of its forms, and we've got a great lineup. In just a few moments, we will be joined by California Assemblyman Ash Kalra and 3 U.S. Congress members, Pramila Jayapal, the chair of the Congressional Progressive Caucus. We'll have Ro Khanna and Barbara Lee, who is Our Revolution's endorsed candidate for U.S. Senate. So I hope that you'll join us in taking action tonight. We need to build the groundswell to fix this broken healthcare system in America. Really appreciate all of you tuning in. Let's get things started. Folks, if you're in the Zoom, talk to us in the chat. Tell us where you're from, why you're tuning in tonight, and what you want to see in terms of the fight for Medicare for all, CalCare, drug prices, medical debt. How are you affected by each of these healthcare injustices in our country? If you're watching on Facebook or Twitter, please like and share this live stream to get it out to as many people as possible. Let me start reading a few names in the chat. It's really starting to pour in now. We've got Latanya in Houston, Texas. We've got Susan from Austin, Texas. Jackie in Bolingbrook. She says she's got too many issues to list with our healthcare system. We all feel her on that. Suzanne O'Shea in Eugene, Oregon. Peggy from Brighton, Michigan. Thank you guys so much. Let's keep the chat rolling. If you're on social media watching, definitely type in the comments. Let's boost us in the algorithm. This is going to be an amazing town hall tonight. I want to give a big thank you to all of our grassroots supporters out there. You make everything we do possible, and you're very much appreciated. If you're not already a recurring monthly member of Our Revolution, I want to personally invite you to sign up today and help power this movement. We're dropping the link in the chat right now. Once again, if you're just tuning in, my name's Amanda Nichols. I'm the communications director here at Our Rev, and we're just about to start our live town hall to organize for healthcare justice for all. So tonight we're going to be talking to California Assemblyman Ash Kalra and Congress members Pramila Jayapal, who chairs the CPC, the Congressional Progressive Caucus, as well as Ro Khanna and Barbara Lee, who Our Revolution is proudly endorsed for U.S. Senate. Keep telling us your thoughts in the chat. Why are you fighting for healthcare justice? We have Randy from Sacramento. We have Paulina in Vancouver, Margot Smith in Berkeley, California, Zipporah Collins also in Berkeley. We've got Alight in Washington, D.C., Leslie Van Dam from Houston, Celeste Walker in San Jose. A lot of folks, holy cow. Alex from Dubuque, Iowa, David Sonneborn from Orange, California, Jackie in St. Paul, Minnesota, Erica in Seattle, Alice in Seattle, and Cynthia in San Rafael, California. Looks like we've got a lot of West Coast folks tuning in. Don't forget, like and share this on social media. Go on Facebook, go on Twitter. We're live there. Definitely get it out to your friends and family. Get them in the fight for healthcare justice. Let me read a few more names as the call builds and before we hand it off to our host. We've got Billy in Sacramento, Lori in Palmdale, California, Brandy Markman in San Francisco. We've got Kathy P. from Lakewood, Washington, Carl in Green Bay, Wisconsin. Love giving all these shout outs. I love seeing everybody making connections here in the chat. Gina in Marina, California, Charlotte in Eugene, Oregon, Amy in Hartford, Connecticut, and Jean from Burlington, Vermont. Jacqueline says, losing everything and going into debt from medical costs is awful. Insurance pays as little as possible. We all know somebody who can relate to that, if not ourselves. Healthcare is a mess in this country, and it's going to be up to all of us building the pressure necessary to make our government act. That starts maybe getting single payer at the state level with CalCare that we'll be hearing more about tonight. That would help pave the way for Medicare for all at the federal level. We've also had some news this week with Bernie moving out about with charity hospitals not upholding their end of the bargain for the tax breaks they get. That's one way that people get into a lot of medical debt when they don't need to. We've got Andy in Las Vegas, Deborah in Antioch, California. And Tahir says, howdy, let's get a great single payer for all in place. Couldn't agree more, Tahir. With that, let me hand it over to our host for the evening, our Revolution Executive Director, Joseph Gevarghese. Joseph, take it away.
Thank you, Amanda Nichols. Brothers and sisters, my name is Joseph Gevarghese. I'm the Executive Director of Our Revolution, and I want to welcome each and every one of you to our Organized to Win Town Hall. We've got over 2,000 progressives who are joining us in our Teletown Hall service. We've got, it looks like a couple hundred gathering together in the Zoom room. We and thousands more watching on social media. We are all gathering together this evening because we are united. We are united in a mission to organize to win a more progressive America that puts people over profits and lives up to our highest democratic ideals. At Our Revolution, we've got an inside-outside strategy to win. Not only do we mobilize the grassroots to elect progressive champions, but we also organize our movement to partner with our elective allies to win transformative policies like Medicare for All. And that is the topic of our call this evening. How do we expand healthcare to every human being in our nation? And we've got a powerhouse lineup talking about that issue tonight. We've got California Assemblyman Ash Kalra and 3 members of the United States Congress. We've got Pramila Jayapal, who we all know and love as co-chair of the Congressional Progressive Caucus. We have Bernie 2020 co-chair Ro Khanna with us, and the one and only Barbara Lee, Our Revolution's endorsed candidate for United States Senate. Before I bring up our lineup, let's talk about what our movement has accomplished over a period of time. Bernie Sanders started Our Revolution in 2016. And 2 runs later, he galvanized a movement that made Medicare for All, universal single-payer healthcare, a central item on America's political agenda. Medicare for All is now a household name, and it's up to us, brothers and sisters, to make it a reality. Since Bernie's run, first 2 runs, we've elected over 1,000 progressives up and down the ballot, progressives who boldly support Medicare for All. In addition to that, our movement leaders have organized to get a majority of Democrats in the United States Congress signed on to universal health care. And we've come close because we organized an inside-outside strategy with the CPC, right, to expanding Medicare in Biden's Build Back Better plan by lowering the Medicare age and including dental, hearing, vision as part of the package. Unfortunately, we got obstructionists like Kyrsten Sinema and Joe Manchin who stood in our way, but our fight continues. We kept up the pressure, and we struck a big blow to Big Pharma. In the Inflation Reduction Act, we were able to open the door to get Medicare to use its bulk purchasing power to negotiate to lower the prices of prescription drugs. It is a down payment on transformative change in the pharmaceutical industry. But brothers and sisters, our work is just beginning. Our movement is organizing all across the country to make healthcare for all a reality. We have members who are passing Medicare for All resolutions. We've been pinning elected officials. We've been interviewing candidates who want our endorsement. and making sure they pass our litmus test. The thing is, the reality that we all know is this, that the for-profit healthcare system in our country has driven up the cost of care, and it has forced millions upon millions of people into crippling medical debt. And that's why our movement and that's why our revolution has been organizing to get patients who are being screwed by our healthcare system to stand up and to say enough is enough. Last week, Bernie Sanders' Help Committee issued a new report that shows how people are ending up with massive medical debt burdens. And part of the reason is because hospitals, tax exempt, not for profit hospitals, get lucrative tax breaks, but fail to use it in order to provide free and reduced price care as they are obligated to do. In other words, what Bernie is showing is that the American healthcare system is once again fleecing American citizens. That being said, right, we're not just organizing at a federal level to highlight the contradictions in the system, the problems in the system. We're also fighting for solutions. In addition to pushing for Medicare for all in the state level, whether it's in New York or Washington State or California, we are pushing for universal single payer. Tonight, we're going to hear more about all of these efforts from our amazing lineup. But that being said, we're going to really focus in on some of the work that's happening in California, which is the leading edge of the fight for transformative healthcare justice. And for those of you who are joining from California, I want to invite you to join our healthcare action team and take action to get your assembly people to support Ash Kalra's bill, CalCare, that would create a single payer system in California. The link is in the chat. And with that, brothers and sisters, I want to introduce one of our members. She is an activist. She has been part of our patient advocacy team. She has been door knocking members of Congress, as well as organizing on this issue. Her name is Kristen Noreen. She hails from the great state of Washington, and she has had a terrible run-in with the healthcare system. Kristen, welcome to our call. Tell us a little bit about your experience.
Thanks, Joseph. Thanks for having me back. I'm Kristen Noreen. I'm 59 and I live in Bellingham, Washington, a few miles too far north to vote for Ms. Jayapal, but I've read her book and I'm a fan. In 2009, I had a $70,000 job with full benefits. I was downsized in June that year and continued working as a self-employed contractor. I was on a $600 a month COBRA plan in 2010 when I was hit by a car on my bike. I was in the ICU for a week and in the hospital for 2 months. I had 8 months of outpatient rehab after that. I had 15 fractures, an amputated hand that was successfully reattached, heavy organ damage, and a traumatic brain injury. My hospital charges were over $1 million. Auto and health insurance covered all but $60,000. I got a charitable grant for $50,000 and had to cover $10,000 on my own. Ongoing follow-up care is barely covered under my Affordable Care Act plan, and I keep racking up more debt. The deal is the care I need to function well enough to work part-time is not covered by most insurance plans. I need chiropractic, acupuncture, and massage on a regular basis. Only chiropractic care is partly covered. My copay is $50 a visit. I racked up $60,000 at one point and filed for bankruptcy. I'm back up to $10,000 on credit cards, and I end up with a tax penalty every year for not paying my estimated taxes on time because I need the money for the doctor. I've been denied disability and I work part-time from home as much as I'm able to. I have little incentive to do better because when I make more money, I have to pay back my Affordable Care Act subsidy up to $800 per month rather than pay off my debts. At one time, I qualified for Medicaid, but they weren't able to provide the level of care I need, and it's their policy not to provide the medication I need for chronic pain. I was actually banned from my orthopedic surgeon's practice over a $125 bill. I can't make as much money as I need to live month to month with my health issues, but I refuse to simply give up and stop getting the care I need to function my best. I've already sold my home and my car is 17 years old. My retirement account is gone. My parents took out a home equity loan in order to help, and my drain on the family finances has limited opportunities for other family members to get a boost. When I was lying in the hospital on a respirator, I assumed, like any American would, that I would at least be set for life. If I'd known how it was going to be, I might have given up. I'm glad I didn't, but there's no end in sight for this debt cycle.
So, Kristen, thank you so much for sharing your story. Tell us a little bit about why you're involved in our revolution, in our advocacy work. What do you want to see?
I want to see this not happen to anybody else. It's probably too late for it to help me very much, but if I could make a difference for other people and not have people lose everything like I have, it'll be worth it.
That's right, Kristen. And on last week's call, where we were speaking on the issue of addressing climate change, the advocates we were talking about, talked about how change begins with sharing your story. And I want to thank you, Kristen, for again sharing your story and making sure that this injustice, this tragedy doesn't happen to other people. I want to bring up some of our panelists to react to your experience and then to talk about the work that they're partnering with us to accomplish. Our first guest tonight is Congressional Progressive Co-Chair Kristen Noreen's hero, U.S. Representative Pramila Jayapal. We've been working the inside-outside game, a strategy of change with Pramila for many years. Congresswoman, welcome again to our Revolutions Organized to Win call.
Well, thank you so much, Joseph, for having me back. You know that our revolution has a deep, deep place in my heart, and it's always just so great to be with people who are organizing on the ground. And Kristen, let me tell you, even if you're a few dozen miles north of me and can't vote for me, I am fighting for you every day, and I'm not going to stop. And I'm going to keep your story in mind. And I want to just thank you because, as Joseph said, what we know as organizers is that stories matter. It takes facts and it makes them real life human beings that we're talking about. And so your courage in sharing your story, and I am just so sorry for what you've gone through. Nobody should have to go through that. And I'm deeply grateful to you for just hanging in the fight and fighting for other people, even if you know we may not get it in enough time for you to benefit. To me, that is the ultimate of basic core human goodness and love. So I want to thank you for that, Kristen. And I want to thank all the people who are on the call here, the organizers, the advocates, the patients, the caregivers who are pushing for a better system, because really you're at the core of the movement. And it's just a privilege to be able to join you. I am, as Joseph said, the chair of the Congressional Progressive Caucus. We have 103 members at the Progressive Caucus, and we have been fighting very, very hard to make sure that our movement wins. And we are getting some wins, not enough wins, but we are building towards that big win. We are building towards something really big, and you can see the progress in your states and cities across the country. From the introduction of CalCare at the state level to the Medicare for All Act, that is my bill, being co-sponsored now by more than half of the Democratic caucus and 13 powerful committee ranking members in the United States Congress, our movement continues to gain momentum. And frankly, it's easy to see why, because more than 85 million people across our country are underinsured or uninsured. And that includes over 28 million people in the richest country in the world who don't have any health care at all. That's not to mention, and you heard it from Kristen, the millions who are drowning in medical debt and the millions who are one broken bone, one car accident, one new prescription away from medical bankruptcy. And it's why we have been advocating to get rid of that medical debt. It is wrong that we have people who are drowning in medical debt. An estimated 68,000 people die every year solely because they can't afford healthcare. And to me, that's just shameful. And I know that I am preaching to the choir here, but let me just preach. That is 68,000 families missing loved ones. That's 68,000 stolen birthdays. That is 68,000 lives that are taken way too soon. And it's all because we live under a cruel system that puts profits over patients. Now, we should have learned our lesson with COVID-19 because COVID-19 made it crystal clear. Health insurance should not be tied to employment. Just imagine the cruelty of this. Nearly 27 million people lost their employer-sponsored healthcare during the pandemic at a time when health insurance was most needed. So they lost their job and they lost their healthcare. In what world does that make any sense at all? So it's no wonder that we're gaining traction. It's no wonder that the anti-Medicare for All people are putting more and more money into trying to defeat our movement because they understand that the people are behind us. They know that Medicare for All isn't just good policy that saves working families and taxpayer money. It's actually incredibly popular. 70% of Americans support Medicare for All. Now, that's before all the big attack ads come from big pharma and private insurance companies. So I get that we have a lot of work to do, but it wasn't always this way. This movement, our movement, your movement, the Medicare for All movement is years and years and years in the making. And we faced incredible obstacles along the way. I was just remembering that back in 2017, at the Congressional Progressive Caucus, we presented our annual people's budget. This was our vision for a bold, progressive government. And in that budget, we included a provision that would empower states to transition to single-payer healthcare systems, just like CalCare. And it also included, at that time, what was considered kind of radical, which was a public option. This was 2017, a year after Bernie's first presidential campaign, where support for Medicare for All caught fire nationwide. That year, more people signed on to Medicare for All in the House and the Senate than ever before, but nothing like what we have today. And our budget, which included Medicare for All, received over 100 votes in the House. I voted for it. My good friend who's on this call, Congressman Ro Khanna, who's been such a champion on this issue, voted for it. And yes, of course, Congresswoman Barbara Lee. Barbara Lee speaks for me. Barbara Lee also voted for it. So we've made incredible progress in the House, but we're still facing serious efforts to try and not just defeat Medicare for All, but also the efforts that are trying to privatize Medicare with privatized Medicare Advantage plans. And I saw some comments in the chat about it, and it's absolutely right. Our movement has been pushing back every step of the way. And for the first time, I think we are actually beginning to put real barriers in the way of these private for-profit insurance companies and big pharma. But what we must do, and what our revolution knows, because they endorsed her, is we have to continue to elect more true universal healthcare champions to the Senate, just like my friend Barbara Lee. From day one, Barbara Lee supported Medicare for All in Congress. She authored a bill similar to Ash Kalra's CalCare at the state level. And thank you, Ash, for all the work you're doing in the California legislature. Barbara Lee has always been with this progressive movement. She has always been leading this movement. And it's why it is so important that we elect her to the Senate. And it's why it's so critical. And thank you, Our Revolution, that Our Revolution is backing her field organizing effort in this race. Because what we need are courageous champions, not people who wait for others to tell them what to do, but champions who actually know what is right. And then they do what is right because they know that as leaders, they can help lead. They can help people to think about this issue in the way that it should be thought about. And then they can bring others along with them. Champions that will prioritize the least amongst us, champions that will fight for all of us, not just some of us. That is Barbara Lee. And forgive me for taking a minute to talk about her, because I just think it's important that people understand that without a doubt, she is one of the most courageous people I know. In fact, she's actually one of the reasons I thought, well, maybe I could run for Congress, because here's somebody who has the courage to do and say what is right, even when she's being opposed by all of the people in her own Democratic caucus. So without doubt, she is one of the most courageous people I know, someone who will build the coalitions that we need and do the organizing on the inside in the Senate to get more senators to acknowledge what we all know, which is that the healthcare system is broken and we need Medicare for all so that we finally give Americans what they deserve. Universal, comprehensive healthcare that prioritizes people, not profits, and with everybody in and nobody out. So I'm just really thrilled about Barbara Lee running, and I'm really thrilled about Our Revolution doing the organizing on the ground to help her win, because I'm not going to sugarcoat it. Look, the path ahead is tough as we battle these very well-funded campaigns that are bankrolled by the very big pharma and health insurance companies who are profiting right now off of our pain and illness. And some people don't know this about me, but a long time ago, one of the reasons I decided I wanted to go into organizing work is because I worked on Wall Street. I worked on Wall Street doing leverage buyouts. I know what an IPO is. I know what those prospectuses look like. I know how this works. And I looked at the prospectuses of these private insurance companies. They are banking on being able to privatize Medicare through Medicare Advantage. And they're like, hey, this is great. This is what we're going to do. Not only are we not going to expand Medicare, but we're actually going to privatize that system and make profits from your pain. So in the face of relentless attacks from MAGA Republicans on the right, to reproductive care, to abortion, gender affirming care, we are making it crystal clear that Medicare for all means healthcare is a human right that cannot be taken away. And look, I know that sometimes it feels like we're pushing boulders up mountains. I think that's what we've all done for most of our lives, is pushed boulders up mountains. But the inside and outside organizing to pass Medicare for all works. It is the power and the strength that we need to push those boulders up mountains. And you know, from Ro, from Barbara, from me, from so many of our Congressional Progressive Caucus members, that we are building something inside Congress as well, so that we can make sure that we have an inside-outside movement fighting right alongside you. Everyone in, nobody out. And I'll be there every step of the way. Thank you, Joseph, and have a great, great evening and organizing effort. Let's get everybody out and let's make sure everyone's in and nobody's out.
Amen. Preach. United States Representative Pramila Jayapal, chair of the Congressional Progressive Caucus and our partner in progress. A key architect of our inside-outside strategy that we're going to keep fighting for. And we all heard what Pramila said. The road ahead is tough. The enemies of progress have a plan: privatize and plunder, and they have resources. And what we have to do is organize, not just on this issue, but we have to organize electorally to make sure we send more true Medicare for all champions to the United States Congress, and that includes sending Barbara Lee to the U.S. Senate. So, Pramila, again, thank you for taking time out of your schedule. Next up, I want to bring up Ro Khanna, United States Representative from California, Bernie 2020 co-chair. Ro, we've been working together to tackle the plague of medical debt. You want to tell us a little bit about that and your work on expanding healthcare more generally?
Well, thank you, Joseph. Thank you for your incredible leadership. You were one of the first people to be talking about medical debt back when President Obama was a senator. And I don't know if that speaks to your early commitment or the frustration that we still haven't gotten it done 20 years later. But you've been a champion, and we are going to get this done. And Larry Cohen, who I know is speaking to Democrats abroad and joining early in the morning. I do want to just give a shout out before she has to go to Pramila Jayapal. You know, Pramila, and I say this very objectively, has transformed the Progressive Caucus in the Congress, where it is now the largest force in the Congress in terms of actual impact. When I first got to Congress, we had good leaders, but you know, it was more a social club. You'd go, you'd get lunch, you'd chat, we'd all talk about how we wanted progressive policy, and then everyone would leave, and we'd have guest speakers. Now, Pramila's leadership over the last 4 to 6 years, really, it's become effective. We're getting things done. We got the child tax credit, the American Rescue Plan. If you want to know what a progressive vision looks like, look at the American Rescue Plan. By the way, it's not coincidental that that's when the president's poll numbers were the highest, when we were doing things for working families, when we were pushing out policies that were helping people. That was the power of the Progressive Caucus, and it's only going to grow. And Pramila has been great, not just on Medicare for All, which is her bill in the House, but also on the caucus. And I appreciate her leadership. And I appreciate Ash Kalra being here. Let me just be very clear about CalCare. The other bill is fine. You know, politicians, when they don't want to do something, they pass a bill to study it. That bill is basically, let's study what it's going to require for a waiver. I just want to be very clear. You get a waiver only after you pass a single payer bill. You don't need a waiver when you don't have a bill. So you first have to pass CalCare before you can even discuss about whether you need a waiver. The second point is that you technically don't even need the waiver. And I have the waiver bill in the House of Representatives. All the bill does is it makes it faster. But don't be fooled. What was passed is not single payer. What was passed is politicians who want to claim that they're for some healthcare solution, passing something to make people feel good about their own political future. The real single payer bill is Ash Kalra's bill. It's a bill that actually funds single payer across California. And it is not some ambitious proposal that's unrealistic. It's what the governor ran on, why we endorsed him in 2018. It's what he ran re-election on. We need to pass this bill. This is what the nurses are behind. This is what Bernie Sanders is behind. This is what Barbara Lee and progressives are behind. This is where our energy has to go. And why do we need to pass CalCare? Because otherwise you have massive premiums. You have massive copays. You have people who are being denied care, even in California, because they can't afford the care. And it's not just people who are uninsured, it's people who are underinsured, you know, who have to figure that they don't want the cough or being sick because they fear what that means in terms of going to a doctor and the bills that could ensue. And so they conveniently ignore it, and because they are afraid of the cost of healthcare. That's who Ash Kalra is fighting for. It is my highest priority in California to see his bill pass. That has to be the organizing call, not just for our revolution, but for progressives in the state. If we get it passed, I believe we can get the governor to sign it because he promised that he was going to sign it. And let's be clear why Ash is having so much problems. Because the big insurance companies and the big pharma companies give millions of dollars to the state legislators and statewide officers. And we need to call that plainly and speak plainly. Either you're on the side of the people, either you're on the side of CalCare, or you've been on the side of big money. And that is really why Ash is having so much trouble, because the polling is overwhelming. People want this. It is the big money that is stopping this bill. The final points I want to make, other than talking my end with Barbara Lee, is on medical debt. And Joseph has been the strongest voice, and I've been working with Bernie Sanders. The reason it's taken a bit longer is Bernie really wants to come up with a bill that's going to move. He's the chair of the Help Committee where he can get it to move. And the point is, hospitals have a tax-exempt status. Hospitals are collecting on debt while they're getting tax benefits from the federal government. We need to make sure that hospitals are not engaged as being debt collectors when they are getting these extraordinary federal subsidies. It's really that simple. And the crux of the bill does that. It says hospitals have to write off debt that an individual may have and not become a debt collection agency. given that they're getting so much federal subsidy, given that they're getting so much federal money. And they need to stop with the punitive pricing, the outrageous pricing for individuals. We also will have a provision in the bill for get people's debt paid if it's now on credit card to be able to wipe that debt clean. It's about $80 billion of debt. Cleaning that out for over 100 million Americans would be life-changing. It would give people the opportunity to start saving, to possibly save towards a home, to pay for education. No American should go in debt to get medical care. I mean, it's when you say it, it sounds so obvious. Who should go into debt to get care for their health, for asthma, for diabetes, for heart disease? I mean, you should have health care in this country without going in medical debt. And that is something that I believe is not just a progressive value. It's a value that Democrats and Republicans share. It's an American belief that if you work in this country, if you're an American citizen, if you're an American resident, if you're even, in my view, it should be anyone living in America, documented or undocumented, you should not have to go into medical debt to get care. So we're going to continue to push for that. I want to just end with why I think Barbara is so well positioned and why we need her. She was for Medicare for all before anyone really was for Medicare for all. She was talking about eliminating medical debt before anyone. She's been the only person who opposed the war in Afghanistan expanding. When I used to say that 2 months ago, a month ago, that's it. Okay, that's great. Now we need her voice. Now we need her voice. She's the only person talking clearly, boldly, loudly about the Palestinians also who are being killed in Gaza. Yes, she's condemned the brutal Hamas attacks. Yes, she's said that she stands in solidarity with the suffering of the Israeli people and with Israelis, but she's talked about ending the cycle of violence, having a political solution, making sure that we have food, water, electricity, fuel getting into Gaza. She's the only one who's doing that, and in the race. And this is the time we need a candidate who's going to caution against another expanded war. And we need a candidate who's going to stand up for Medicare for all, for Ash Kalra's CalCare bill against medical debt. So I believe this moment, I've seen the activism. I really have of the community, especially right now with what's going on in the Middle East. I believe if we mobilize, we can get Barbara elected. We can get Ash's bill across the finish line, and we can really build a progressive future starting in California. So thank you, Joseph, for your incredible leadership.
Representative Khanna, thank you for your leadership on healthcare and other issues that are vitally important to the progressive movement. Before I bring up Barbara, I want to bring up Ash Kalra to talk a little bit about the bill that he's been leading on. A bill that was developed originally was modeled on Barbara on the bill that Barbara led on. And I want to bring the Assemblyman on to talk about that bill. And part of the reason this bill is important is because we do need a model at a state level that we can create a precedent to export up to the federal level. Just like, we've got to fight this fight on multiple levels, whether it's at the state level, whether it's addressing the medical debt crisis at the federal level, whether it's electing more progressives to serve in the United States Senate alongside Bernie Sanders. We have to have a multifaceted approach. But Ash, I want to bring you up to talk quickly about your bill. But my first question is, what is the other bill that Congressman Khanna was referring to?
Thank you, Joseph, for having me. It's great to see you. Thank you for your work. Great to see, as always, my friend and neighbor, Congressman Ro Khanna, and of course, Pramila Jayapal, a wonderful progressive leader nationally, and our Congresswoman Barbara Lee. It's an honor to be with our three great progressive congressional leaders. And so, Ro touched on it a little bit. The bill that was passed is yet again a study bill. Yet again, let's report back on waivers. The reality is what the bill is asking to do, we already have the answers to. We know what waivers are about. We know what it takes to get waivers. You have to pass a policy bill. This is something that is not just my opinion or Congressman Cunha's opinion. I sat down with Javier Becerra, the HHS deputy, and very clearly spoke with him for an hour and a half and his team, and spoke very directly about what it would take for us to get waivers. And it's very clear that we have to pass the policy bill. There are plenty of Medicare waivers that are currently existent throughout our country. In California even has some operating on kind of like targeted programs, focused programs. Each and every one of them first had to get passed in the state legislature as a policy bill signed by the governor. Then the waiver application process commences, which makes sense because you can't do a waiver application if the federal government doesn't know what it is that you're trying to fund, and they have to see what the policy is. And so, the bill that was passed is yet again another, let's have another report back, and we don't need more report backs. We've had for 20, 30 years, study after study after study, even with CalCare, even with Ricardo Lara's bill prior to that, reports that have come from our own analysis, from our own staff, make it very clear that a single payer healthcare bill will save the state money, it'll save lives, and we don't need any more reports to make that clear. What we do need is a policy bill to be passed by a state. California, Washington, New York, one of them's got to do it. I feel that California is in the best position to do it. We have a very strong, large economy, and we have the ability to sustain, especially the upstart costs of a single payer system like CalCare. And so I'm going to continue to push as hard as I can. We have a great movement here in California, and I'm looking forward to move it forward when we come to January.
And Ash, tell us right now what the timeline looks like. So introduction in January, and what happens after that? And then at what point do you need our members in California to throw down?
Well, I would say we need people to throw down now. What I mean by that is this is a movement, and it's going to require kind of a buildup. And so, signing the CalCare petition, for example, at calcarepetition.org is a great way to start becoming part of that movement. Join your local CalCare organizing committee. Stay informed as well. But it will absolutely, it's about building up to when we get to January. And so that begins now. As mentioned, we've had a series of town halls during the course of the last few months working with our California Nurses Association. They've been incredibly successful. We have folks on the ground, at farmers markets. We have folks knocking on doors. And so there's no doubt when we get to January, we'll really need that big push. But over the next couple months, I really hope that people continue to join the movement. When we get to January and we have the introduction of the full policy bill, it's going to be a really huge opportunity for us to continue to reach out to legislators, to my colleagues. I'm going to continue to reach out to them and talk to them one-on-one when we have the opportunity to talk about the specifics of the bill. But AB 1400, CalCare, now we have AB 1690, which is kind of the placeholder bill that has the intent of bringing forward the full policy bill. The policy's out there. It's very clear. As there's no reason why folks can't look at it now, or why staffs can't look at it now. But the bottom line is single payer healthcare is not something foreign to folks. We know what it is. It's been studied time and time again. CalCare, is something that's very clear to folks about how we can get the greedy insurance companies out of our healthcare system and rather have a system that we still have the same doctors and nurses and providers. They're just funded through one source, the state CalCare fund. And we consolidate all the sources of funding from the federal government. The reality is most of our healthcare system is already paid for by public dollars from federal and state dollars. The rest of it is paid by businesses, small businesses, companies, and by individuals. And they're getting ripped off. The businesses are getting ripped off. The individuals getting ripped off. Even with the most expensive healthcare system in the world, we have people dying. We have medical debt being the number one cause of bankruptcy for families in our state. So our system is not working. It's broken. But I just want to say this. Look, we know it's not going to be easy. It is pushing a boulder up a hill, but it can be done. It can only be done if we're persistent. As Nelson Mandela said, it seems impossible until it's done. But if I would be so bold to add something to it, it can't be done if we stop. It's what Mandela was talking about was persistence. You can't stop, because when you're pushing a boulder, you don't know when you're finally at the top and reach the pinnacle and it starts rolling downhill. You're pushing it blind to some extent. But what we do know is that with our movement, we can get it done. With a senator like Barbara Lee, we absolutely can get it done. So with the joint support from Senator Padilla, who has been fantastic on this issue, by the way. And so I think we have a great opportunity to get it done this next year. We have colleagues, and folks always ask me about why couldn't we get it done last. We have a whole new set of colleagues that got elected this year, many of whom campaigned on single payer and even specifically CalCare, that replaced folks who didn't, who replaced Republicans even. And so we have a much better assembly in that regard, and an opportunity to get this done this next year. We can't stop. Lives depend on it. Thank you, Our Revolution, for being the wind, behind our sails to continue to push us.
Assemblyman Ash Kalra, thank you for joining our Organize to Win call. For all of our California members, I urge you to sign up to get involved in the fight to pass CalCare. The link is in the chat. We need to have an inside game and an outside game. We need grassroots pressure that's going to have Ash's back when it comes January. And that starts with each of us speaking up, telling our stories. And with that, I want to bring up the OG on healthcare, United States Representative Barbara Lee, soon to be United States Senator Barbara Lee. One of the key reasons that our members voted to endorse Barbara for the U.S. Senate, because she was one of the leading proponents for single payer, not just in the United States Congress, but when she served in the California state legislature. And just like Pramila said, we've got to send someone who really believes in our movement to Capitol Hill and to the United States Senate, because we need more partners on the inside to get this boulder over the top. So with that, I want to bring up Representative Barbara Lee. Welcome, sister.
Hi, Joseph. Hi, everybody. Listen, thank you so much, Joseph, for keeping us very organized, very focused on what we need to do to make this world a better place. And that's what it boils down to. And I just want to thank you for your leadership. Also, let me just associate myself with Rose's remarks about Pramila. I'm a former co-chair of the Progressive Caucus, and I know how this Progressive Caucus has grown and become powerful under Pramila's leadership. And so I just have to thank her for her bold leadership. She's a very strategic thinker, but also she's an organizer, and she's brilliant. And so just know that we're in really good hands in the Progressive Caucus, and we're making a lot of progress to make sure that this country understands, and especially California, that healthcare is a basic human right. And to Ro, my co-chair of my campaign, I just want to thank him for his kind remarks, but also for his leadership. And, working with Ro on all of these issues and with Pramila in the House of Representatives is really, for me, such a remarkable moment, because for so long, it's been only a couple of us who've been on the front lines, standing up early on, leading. And so now, boy, we have an army of progressives. So I just want to thank Ro also for his leadership. And to Ash, let me thank you. Let me just say a couple things. Thank you for your support. But you know what? I'm throwing down now, on CalCare. I mean, my campaign is throwing down now on CalCare, because we have to understand that we've got to get the profit motive out of the healthcare industry. This should not be an industry. And so I just want to thank you for carrying this ball forward, Ash. And yes, when I was in the California legislature, I did introduce the very first single payer initiative and bill, but you know what? We studied it then. We don't need any more studies. I mean, this is 2023. Come on. So forget those studies. We know what to do, and we know that we need to pass CalCare. No more studies. Okay, let's get this done. Every person in our country should have quality, affordable health care, whether they're rich, whether they're poor, whether they transgender, trans, LGBTQ plus, Black or brown people, everyone, suburban, urban, young people, our seniors, our disability community, everyone in this country should have affordable, accessible health care. And to guarantee health care for all, single payer is the only way we can do that. Now, I'm no stranger, as you know, to single payer, but I didn't discover a single payer late in my political life. I almost, and I just have to share this story very quickly, Joseph, and to all of you. I almost didn't get into this world because of the racism in our healthcare system. When our mother went to the hospital, she was denied access. She was denied entry into a hospital. She almost died while giving birth to Barbara Lee. And I almost didn't get here into this world because of the racism and the systemic barriers that were presented before my mother. And she almost didn't have an opportunity to live and to see me born. I mean, that's the bottom line. So, this is important to me because we still are seeing Black maternal mortality rates and Black infant mortality rates off the scale. Single payer would address that in a big way. Everyone, Black women, women of color would have access to affordable health care. Also, when I was a young mother myself, let me tell you, I lived in England and I experienced firsthand the care that they afforded to every citizen. I was amazed. And so this is nothing new to me. And that's why it is so important that we get to work and throw down now and pass CalCare and incorporate this into our campaign. By profession, I'm a psychiatric social worker. I have my MSW. I didn't need to be told that people who were living on the edge, who had mental health issues, who were stressed out, that they needed quality health care and mental health care together. And you shouldn't have to lose your health care coverage just because you lose your job. Mental health parity is so important. Healthcare access is extremely important. And the only way we get to healthcare access that's affordable is through single payer. Again, I have to just keep going back to the profit motive because this country, we have a corporate model of healthcare. Healthcare should not be an industry. Also, when you talk about prescription drugs, people are still cutting their pills in half just to make sure that they have their medicines and can afford their medicines. The pharmaceutical companies should be ashamed of themselves. And yes, we have reduced and allowed for bulk buying of prescription drugs. But you know what? Fortunately, for those on Medicare, we put a ceiling of $35 a month. Well, that's great. And we are on the right path. But you know what? We need that for everybody, not only Medicare recipients, but we need to have these pharmaceutical companies, get them under control and provide access to prescription drugs that are affordable. Once again, single payer CalCare will do just that. And so finally, I'll just say we have to make sure that women's health care is part of our strategy. And I know that with single payer, women will have access to affordable health care. And we're going to talk about reproductive freedom on another call, another meeting. But let me just say that I know I mentioned my birth story, that reproductive freedom is important for women to have make their own health decisions about their bodies. We don't need insurance companies. We don't need accountants. We don't need any corporate entity making healthcare decisions for anyone. And so thank you, Joseph. Thank you, Our Revolution, for this. I want to just say to you that I know that single payer is the only strategy and the only healthcare system that will work in America. I was one of the negotiators as chair of the Black Caucus for the Affordable Care Act, and we did a heck of a lot. We put an amazing amount of equity provisions in there. We did a lot in terms of trying to push for a public option. We did put waivers in the Affordable Care Act for single payer, but we didn't get to where we needed to go. And so we have to pick up that ball and keep running with it, because when you look at the disparities in healthcare as it relates to Black and brown communities, to poor communities, and to many low-income people, you know, and I'm leading the effort on our health equity bill for the Asia Pacific American Caucus this year for the next 2 years. But it's so important to realize that we wouldn't have to do this. We wouldn't have to fight for health equity and equity for our Native American communities and for people of color if we had single payer. And so this would accomplish a heck of a lot for people of color in terms of ending the disparities in healthcare, because you know how Black and brown people are, you know, the lifespans are much shorter, you know, because of social determinants of healthcare and poverty and all of the issues that we have to address because we're marginalized in America. Well, single payer will take that into account and will say no more of that. Everybody is equal. Everyone will have accessible, affordable, and good healthcare. So I'm very passionate about this because healthcare has been so much a part of my life. And I want to see this done in California. And maybe in California, we'll set the stage now. Thank God for Medicare for All and being an original co-sponsor of Medicare for All. And with Pramila's bold leadership and Rose's bold leadership, we'll be able to use the California model and bring it on here to Washington and say, okay, see, Medicare for All has got to be the healthcare system in this country. So California is leading the way again. Ash, I want to thank you very much. We know it's going to be an uphill battle, but that's okay. We're used to that. We're going to fight until we win. And so we're throwing down tonight. Joseph, thank you again for giving me a chance to be with you, but it's going to get done.
Representative Lee, thank you for your bold, progressive leadership over time and for bringing our movement to this moment where, yes, we are closer now to making healthcare for all a reality than we've ever been, and we can't give up, and you give us the hope. One thing I want to point out is it takes a movement, and we've got movement activists on this call who are committed to fighting for universal health care in California and nationally. And we had movement leaders on this call, like Ash Kalra and Ro Khanna and Pramila Jayapal. And we all agree that we need Barbara Lee in the United States Senate. It takes an inside-outside strategy, and we've got to put our allies in positions of power if we are going to win on the issues that matter to us. We cannot gamble with our votes when it comes to these issues. So Representative Lee, thank you very much for taking time out of your schedule to join this panel tonight.
Thank you, Joe. Yes, when we fight, we win.
That's right. All right. Again, thanks to all of our speakers. Brothers and sisters, we're fighting on multiple fronts. We're fighting in California to pass CalCare. If you're in California, you want to get involved, link is in the chat. We're fighting on the federal level alongside Bernie and Ro Khanna, Barbara Lee, to make sure that hospitals live up to their charitable obligation to provide free care to all who deserve it. If you want to join our End Medical Debt team, link is in the chat. Legislation is going to be forthcoming, and we're going to need people like Kristen Noreen, a lot of Kristen Noreens who can share their story, your story about what's wrong with the system as it is. Even though we fought to improve it, we all know it still is not there. And then last but not least, if you are with us and you want to send another Medicare for All champion to the United States Senate, if you want to build up our progressive infrastructure on Capitol Hill, and you want to send Barbara Lee to the Senate, sign up. link is in the chat, progressivesforbarbaralee.com, and one of our organizers will follow up with you. And then last but not least, appreciate your time. And if you have a little bit of treasure, $5, $10, become a member of our revolution, support the work that we are collectively doing to make our world, our country a better place so that we can all lean into our fullest human potential. And with that, I'm going to end tonight's Organize to Win call with our chant. When we organize,
we win.
When we organize,
We win.
when we organize,
We
We
win.
win.
Good night, brothers and sisters. Thank you.